What is the insulin actually having to handle? It's having to handle the things that turn glucose in the body. What is the primary thing you eat in your diet that turns to glucose in the body? Carbohydrate, which is why carbohydrate restriction has always long been held to a high standard as the way to control diabetes, type 2 diabetes. And we got away from that. We got to the point now where doctors say, oh, keep eating your normal diet, it's okay, just shoot yourself with insulin and you'll be all right. And they're not thinking about the ramifications of what that's doing. You're getting all the inflammatory and blood sugar spiking effects of the carbohydrate, then you're shooting yourself with a hormone, insulin, and other hormone altering drugs like metformin and different things to manipulate your inability to handle carbohydrates. And most accurately, if you want to describe type 2 diabetes, it's a disease of carbohydrate intolerance. Now, you don't just wake up one day born with carbohydrate intolerance. It's a direct result of year after year after year after year of bombarding your body with refined grains, maybe refried grains as well, but refined grains, refined sugars, refined oils, all of the basic ingredients of the junk food diet that makes up the SAD diet here in America. And that's how you do it. Like, you cut those things out. You just don't have those things in your diet, and you have no need for insulin. So I have a paper today that says just that. It's published in the Journal of Clinical Investigation, came out last week actually. And the researcher, you probably have heard the name before, is Dr. David Ludwig, very well known. He wrote a book, and I interviewed him on the Living La Vida Low Carb show a few years back. He had a book called Always Hungry. And he was even talking then about the insulin connection and how getting your insulin levels in your body under control will control the hunger. And he's a big low-carb advocate, at least scientifically speaking. He has a few little things that I don't agree with. He's a big fiber guy, wants you to eat, a lot of fiber because that's filling. And I say, well, what about fat? And so anyway, we have the discussions. But Dr. Ludwig is amazing. And he's written this wonderful paper that has gotten published, again, in the Journal of Clinical Investigation. It was a part of the review series celebrating the 100th anniversary of the discovery of insulin. All right, so let's read the paper. Carbohydrate restriction used since the 1700s. A lot of times when we talk about low-carb diets, people go back to the 1800s. And even in Keto Clarity, when I was telling some of the history of carbohydrate restriction, I was talking about in the 1800s with William Banting and his use of a low-carb diet to lose weight. He wrote a book called Letter on Corpulence. It became the #1 best-selling diet book, first one ever around the world. And so that's usually where people go back to with a low-carb diet. But Dr. Ludwig and the rest of the researchers said since the 1700s. And it was used to prolong survival in people with diabetes. It fell out of favor after we discovered insulin 100 years ago. Despite costly pharmacological and technological developments in the last few decades, current therapies are simply not enough to achieve optimal outcomes, and most people with diabetes still remain at high risk for micro and macrovascular complications. This is the thing about eat all the carbs you want, just cover it up with insulin. The insulin will deal with the blood sugar. What they're not telling people is it doesn't deal with the ramifications of the inflammation and the blood sugar hyperglycemia going up, and this high amount, big bolus of exogenous insulin that goes in your body. That's not without consequences. And that's what they're talking about here, and they're going to get into here in a minute. Recently, low carbohydrate diets have regained popularity with the popularity of keto, with preliminary evidence of benefit for body weight loss, postprandial hyperglycemia, so that's after eating, blood sugar going up, hyperinsulinemia, which is a chronically high level of insulin, and other cardiometabolic risk factors in type 2 diabetes, and with more limited data in type 1 diabetes as well. So they call for high quality, long-term trials to assess the safety concerns and to determine whether or not this old dietary approach might help people with diabetes attain clinical targets more effectively and at a lower cost than conventional treatment. See, since I've been online, which is 2005, I lost 180 pounds in 2004 on a low-carb diet, came online in 2005. From the moment I've been online, all I have heard about low-carb diets is how dangerous they are, how incredibly bad for people, heart disease risk, cancer risk, all-cause mortality risk, even diabetes risk, and that they should be avoided at all costs, and the K word is basically the devil. That's basically, in a nutshell, how I have viewed things since I've been online. And things haven't really changed that much. The only thing that I can say about 2021 as compared to 2005 when I came online is people are more accepting of carbohydrate restriction now. And even in the American Diabetes Association, which is the biggest advocacy for diabetics here in America, they now at least have a low-carb option for people. So the lady that took over the ADA is a lady with type 2 diabetes, and she was able to control it with a low-carbohydrate diet. So she uses it herself, and so she had it implemented that it should be an option for people to choose from, along with the traditional ADA diabetes diet. If you just joined us, I am reading from a published paper from Dr. David Ludwig, very famous low-carbohydrate researcher, and the paper is called Carbohydrate Restriction for Diabetes, Rediscovering Centuries-Old Wisdom. It's part of a review series in the Journal of Clinical Investigation for the 100th anniversary of insulin's discovery. And it calls for a return to a low-carb diet. And we really need to examine this. Let's look at the safety effects of it. Let's see why this works for so many people to control type 2 diabetes. Practitioners literally around the world are using this approach with their patients. And they don't really have to be on any diabetes medications, maybe metformin, but most of them no medications, and most of them no insulin at all. So they kind of get into that here. Introduction. The primary goal of medical nutrition therapy, so that's what they're calling a low carbohydrate approach for dealing with diabetes, MNT, for diabetes management is to achieve optimal metabolic control. Blood glucose levels in the normal range or as near normal as safely possible. Lipid levels, that's your cholesterol, in the recommended ranges to reduce the risk of micro and macrovascular complications while also preserving normal growth and development as in the case of children. Increasing recognition of the contribution of postprandial hyperglycemia. Remember, postprandial means after eating, hyperglycemia, high blood sugar, to elevated hemoglobin A1C, HbA1c. So that's the average of the last 3 months of your blood sugar levels at all times. It's a blood marker that your doctor can run. And as an independent risk factor for diabetes complications. It highlights the importance of reducing glycemic excursions, and as the principal determinant of postprandial glycemia, dietary carbohydrate offers an attractive therapeutic target. What's never made sense to me in the people who say eat your carbs just covered up with insulin, what's never made sense to me is what is the argument for the carbohydrate consumption? Traditionally, the reason they have pushed carbohydrate consumption, and they usually say a minimum of 130 grams of carbohydrate a day, and that you must have that amount of carbohydrate. Well, the problem is that's not accurate. Yes, you do have specific needs in the body that are called glucose-dependent functions. So there are glucose-dependent functions in the brain and the heart and various parts of your body. But just because the body requires glucose for those functions doesn't mean you need to eat carbohydrate that then turns to glucose in the body. This is where all of these supposedly smart people are very derelict in their education. Because if they actually educated themselves, they would know about the process of gluconeogenesis, where fat and protein can get converted very easily into glucose on an on-demand basis. So if it's demand-driven and the body needs glucose, the body's very, very smart at taking the things you feed it, even if you eat carnivore. It could take the fat and protein that you consume, make all the glucose in the world that your body needs for those glucose-dependent functions in the body, and then distributes it to those places. In fact, just before I came on Jimmy Rants today, I was talking to a friend who was having an elevation in her blood sugar. She was kind of freaking out about it. And then I said, well, what's your blood sugar like the rest of the day? And she said, oh, and it's normal. It's like in the 80s and 90s. I'm like, and your A1C? Oh, it's under 5.5. I'm like, and the 120, you're worried about it. Why? And what she didn't understand was that's where the body's basically saying, all right, you need some glucose. We're going to make it, store it here in the morning, and then distribute it to all those places in the body that it needs, and then you're good to go. And it's such an elementary thing that doctors should easily be able to understand, but they don't. And so they recommend 130 grams of carbohydrate, thinking that that's what you need to make 130 grams of glucose in the body. But when you flood your body with 130 grams of carbohydrate, and on top of that, have fat and protein in there as well, it turns into a metabolic disaster, which then exacerbates type 2 diabetes. Again, if you're just joining us, we are reading through a published paper. It just came out last week in the Journal of Clinical Investigation by Dr. David Ludwig, a very famous researcher, and many others on this paper, Carbohydrate Restriction for Diabetes, Rediscovering Centuries-Old Wisdom, and they're putting out a call. We need to get back to a low-carb diet. If you have type 2 diabetes, your doctor, every practitioner in the world should be using carbohydrate restriction as a means of controlling your disease. You don't need diabetes medications necessarily, maybe for a bit until you wean off of it going on low carb. Maybe metformin sticks around for a little while, but you most certainly as a type 2 diabetic do not need insulin. Qualitative aspects of carbohydrate like fiber are universally emphasized in all nutrition guidelines. However, carbohydrate reduction can decrease your after eating blood sugars, postprandial glycemia, and insulin requirements, meaning if you're not eating the carbohydrates that's causing the need for insulin, you don't need insulin anymore. Much more efficiently than any other dietary intervention, which has always perplexed me about the ADA's traditional diabetes diet. It's very high in carbohydrate. It's very low in fat. So you take away one energy source, fat, and you replace it with another energy source, but that energy source then exacerbates the diabetes, which then requires you to eat more of the energy source that's bad, that's exacerbating the diabetes, so then you shoot them with a drug. Do you see how crazy that is? Whereas if they flipped the script and had them be fat burners by limiting carbohydrate and eating more fat and fueling their body with fat, but then not exacerbating the diabetes, how well is a low-carb diet for people with diabetes? It should be the standard of care. And yet it's not. It also provides additional benefits for reducing cardiometabolic risk factors. When you reduce your carbohydrates, you do so many good things if you're diabetic. You reduce triglycerides, the really bad fat in the body. You raise HDL, you lower inflammation, you lower blood pressure. I could go down the list of all these great benefits that come from carbohydrate restriction, and especially for someone with type 2 diabetes. And just imagine someone with type 2 diabetes as basically someone with insulin resistance on overdrive. It's gotten so bad for these people with their insulin resistance that it actually manifests physically in their body with the inability to control their blood sugar without some major changes in their diet. And that's where a low-carb diet comes into play.